Monday, the 13th of June 2022. About 12 months ago, I created this YouTube channel. Doctors bury their mistakes because of the terrible abuse that I've received while a patient at Westmead Public Hospital. I complained to the General Manager, Rebecca Tyson. She ignored my complaints and covered up, and I complained to the Chief Executive, Graham Loy. He ignored my complaints and covered up. And I complained to the New South Wales Health and Research Minister, Brad Hazzard. He covered up. I complained to ex-Premier Gladys Berejiklian, and she covered up. They both told me to get lost. And I also complained to the current New South Wales Premier, Dominic Perrottet, and he also covered up my complaints. People are dying while this is happening. A lot of people dying. Look what happened in Queensland there, Dr. Deaf, Jayant Patel. So they took no action to rectify the matter, and the Labor Party are complicit in this. This hospital, I said 12 months ago, Westmead Public Hospital is so bad and corrupt it needs to be shut down and start again. Watch this movie.
Pushed to breaking point, putting lives at risk and leaving frustrated families with more questions than answers. Our healthcare system is under severe pressure. It's at breaking point. And fed up with excuses, these people want action as our health crisis becomes a national emergency.
People are dying because they can't get proper treatment.
Logjam Melbourne, logjam Brisbane, logjam Sydney, logjam Adelaide and even Perth. You and Adrian are the human face of this whole schmozzle.
Yep.
Aren't you? Our hospital system schmozzle, because that's what it is.
Yep. Our hospital system, Mike, the way I saw it, I believed it. You know, we were like a third world country.
Underfunded, overloaded, understaffed, overstretched. Our health system critical and families sick to death of excuses. We see it from the outside and we hear it from the
incompetent doctors and nurses, incompetent staff. None of their credentials are checked. Come from India, places like that. Very bad training. They don't know what they're doing, and they seem to resent Christians, a lot of them. And also the doctors trained and nurses, Sydney University, they come from these exotic countries. It's pay to play. They get passed when they should be failed, and they end up at Westmead Hospital. They've got plenty of resources and numbers. It's all corrupt. People dying.
Inside.
I'm feeling really tired. I'm running on empty.
And we hear it from the families.
We shouldn't have to fight for our health.
The health system that should be saving us in far too many cases is harming us. The pandemic and now the flu has exposed an already underfunded service where nurses and doctors are exhausted and stressed, and many are leaving. It's the domino effect.
It's not the funding, it's mismanagement. Mismanagement, not the funding. Give them $1 billion more and they'll still be bad. Mismanagement, right? They're rotten to the core.
It was so full, the ambulances that should be attending other emergencies are forced to sit idle, their patients not receiving timely care. It's called access block.
Appalling. Yeah. When you've got to wait in a waiting room for 15 hours, you have to beg for 2 Panadol when someone's in so much pain.
Getting an ambulance was the easy part for Chris and Adrian Prisman. From there, it was all downhill. Adrian, who has cancer, had a crippling headache and was taken to Monash Medical Centre in Melbourne.
It was freezing in that waiting room and I had to get a blanket and to sit beside a young girl that continuously vomited for 2.5 hours, and people in the waiting room were giving her chuck bags.
Sounds like hell.
Yeah. An 80-plus-year-old man that was there 13 hours plus on his own.
Eventually, Adrian was admitted for 4 days in a day treatment room, then released without, Chris claims, an MRI being performed.
On the day that they discharged Adrian, a doctor rang me in the morning and said that they had diagnosed him with a complex migraine and vertigo. And I said, well, if you have diagnosed that, why did you treat a migraine patient in a well-lit room?
12 days later, Chris organised a private MRI. Adrian had had a stroke.
The window of opportunity when somebody has had a stroke is between 4 and 6 hours. They should have done an MRI to rule out all possibilities of what symptoms he had.
How many times do people go to the emergency department and wait hours and hours? How many times are people waiting at home for ambulances?
Marie Secura's husband Charlie died in Bairnsdale Hospital in Victoria. She claims the hospital initially wouldn't allow her to see him because of COVID rules, even though COVID rules dictate that family can visit a dying relative.
I know that he waited because he took his last...
They use the COVID rules to stop someone going to see the patient because the patient's being mistreated, and then they say you can't get in because of COVID.
The minute I kissed him, I know that, but it just wasn't long enough.
Charlie was a very sick man. After spending 7 weeks here at Monash Medical Centre, he was admitted to Bairnsdale Hospital with pressure sores. For Marie, his death was a shock.
Okay, at 1 p.m, I was able to speak to a doctor. Now, he said to me Charlie had eaten breakfast, that he would be with them for a few days, and everything was fine. I said, can I please see him? He said no.
Quite the character, Charlie. 17 years of marriage, and he never missed a chance to charm his wife.
Charlie was a real romantic. I have got letters, poems, everything. He was not one of these people that pushed himself out there, but he was kind.
They need to sit back and have a really good look at how they're managing the health system for people, because our health of Australians is so vitally important.
Christine Jackson from Ipswich in Queensland knows that better than most. She has a serious lung condition and copped COVID on top of that.
I realised I had COVID, so I went to the Ipswich Private Hospital to get some medication because I have reactive airways disease and felt it was the best thing to do.
Christine claims she was relegated to the ambulance parking bay where she sat on a plastic chair in the rain for 2.5 hours. Then she made a phone call.
I wanted to speak to the CEO or the director of the hospital to see if they wanted to come and sit with me in the outside area where it had been windy and rainy the whole time I was sitting out there.
Didn't happen, but a nurse tried to compromise.
And then said, I've taken a person out of a room and put them into the hallway. I didn't feel that this was appropriate, considering she told me there were people that were sicker than I was.
Australians who feel let down by our health system, who have suffered themselves or who've lost loved ones, are understandably angry. And they're asking this question.
Why aren't politicians listening to us?
Why, indeed. Chris was determined to be heard, so she had a crack at the Victorian Premier Daniel Andrews here in State Parliament through her local member Kim Wells. Here's how that turned.
You listen to the bloody politician Daniel Andrews' response. Politicians, they just lie. Listen to this garbage.
Out.
If you've raised this matter for your own political gain, well, it says more about you.
What do you think of Daniel Andrews' performance here?
Pathetic. The way he come across with that was basically, it was like he was selling cars to anybody. He didn't care about where my husband's plight was.
From one theatre to another.
It's not too late at all.
It could have been too late.
For Marie, it is too late. Charlie passed away last month.
He's not here to put the world back together again like we used to, talking about everything, and just feeling like he's been cheated. And, you know, and to know that I'll never see him again.
It really is hard to believe that healthcare has come to this in a country like Australia. To our leaders right across the nation, it must be fixed.
Dreadful state of affairs. The Liberal National Party and the Labor Party and the Greens, they all need to be put in front of the jury. Just terrible. Destroyed the energy, coal mines are closed now, running out of electricity. And I think solar panels are going to give us baseload power. The whole place, they've ruined the country. God bless us all.